With all of the information being disclosed about energy healing, have you ever wondered if the FDA has jurisdiction over energy healing? And will they try to stop our inherent right to heal ourselves with bioenergy? First, I'd like to explain the purpose of the Food and Drug Administration and why a regulatory structure is necessary. Then we will look at the laws regarding complementary and alternative medicine, also known as CAM, to determine if FDA can try to stop the distribution of the medbeds. The first attempt to control the use of drugs came in 1902 and was named the Biologics Control Act. The purpose of the act was to ensure purity and safety of serums, vaccines, and similar products used to prevent or treat diseases in humans. Gotta wonder what happened to this in 2021. The first true FDA law occurred in 1906 with the enactment of the Food and Drugs Act. It was very simple and basically prohibited the interstate commercial transport of misbranded and adulterated foods, drinks, and drugs. It was passed due to cure all claims for worthless and dangerous patent medicines. That same day, they passed the Meat Inspection Act due to shocking accounts of insanitary conditions in meat packing plants using poisonous preservatives and dyes in foods. There were quite a few amendments to the Food and Drugs Act over the years, but it wasn't until 1937 when a sulfanilamide elixir containing the poisonous solvent diethylene glycol killed 107 people that sweeping drug laws were enacted. Many sulfanilamide victims were children. So in 1938, the Federal Food, Drug, and Cosmetic Act was passed. In addition to extending oversight to cosmetics and medical devices, this comprehensive act required that drugs were proven to be safe. This was the beginning of any sort of pre-marketing testing of drugs. While this was a start, it wasn't enough to protect people of the United States from unscrupulous drug manufacturers. So in 1951, the Durham-Humphrey Amendment was passed that required that the sale of some drugs be restricted to prescription only by a licensed practitioner. It looks like Big Pharma gained a strong foothold in 1955 when the Division of Biologics Control was established. The Division of Biologics Control was an independent entity within the National Institutes of Health. This division was established after about 260 people contracted polio from a polio vaccine. Please take note of what I said. This is an independent body that infiltrated our drug regulatory system. I'd like you to consider the implications of independent parties having input into our drug distribution system after considering that many alleged experts from drug manufacturers were part of this division. Then in 1962, the thalidomide tragedy happened. Thousands of babies were born with serious birth defects from the drug that was being used off-label for fertility. Can you imagine? Public outcry for stronger regulation resulted in the passing of the Kefauver-Harris drug amendments to ensure drug efficacy and greater drug safety. Then a groundbreaking Supreme Court ruling in 2000 ruled 5-4 that FDA does not have authority to regulate tobacco as a drug. I want you to understand the implications of that ruling related to FDA's authority. The reason the Supreme Court ruled that FDA was not able to regulate tobacco is because tobacco does not meet the definition of a drug, which is that it is intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. FDA cannot regulate something as a drug unless they can prove that the intended use is to treat a specific medical condition. This is very similar to the issues addressed when the Dietary Supplement Health Education Act, or DSHEA, was passed in 1996. Which gave the Department of Agriculture jurisdiction over herbs and dietary supplements rather than FDA. The FDA had its hands full at the time with people labeling things to cure all kinds of stuff. Consequently, labeling requirements were made for such products. I am very familiar with this law because I was the person who wrote the state of Florida's recommendations to the Presidential Council on the safe labeling of dietary supplements. I have also been qualified as an expert on dietary supplements in numerous state and federal courts, so it's all about the labeling and the intended use. Manufacturers of putative energy devices have to walk through a regulatory landmine to get this technology out to people, because the FDA has a very broad reach over food and anything intended to treat or alter disease. The question then becomes, but what about practices that fall outside of traditional medicine, like energy healing? Well, that's a fascinating question that takes us into the realm of complementary and alternative medicine, a topic we'll examine in our next segment. So, stay tuned as we explore the FDA's role in this intriguing and often misunderstood area of health and wellness. You might be surprised to learn that the FDA's jurisdiction isn't as clear-cut when it comes to alternative and complementary medicine. When we talk about the FDA, we often think about it in the context of pharmaceuticals, medical devices, and food safety, where the law is quite clear. But the realm of alternative medicine, the lines become a bit blurred. The FDA's jurisdiction primarily encompasses products that are marketed with therapeutic claims. This means things like drugs and medical devices. However, many forms of alternative medicine don't fall into these categories. Practices like meditation, yoga, tai chi, or energy healing, for instance, don't involve any physical products or substances. They're more about harnessing the body's own energy or using the power of the mind to promote health and well-being. As such, they don't fall under the FDA's usual purview. That's not to say that the FDA turns a blind eye to alternative medicine. In fact, the agency has issued warnings about certain types of alternative treatments where medical claims have been made. But the FDA's hands are somewhat tied when it comes to other forms of alternative medicine, particularly those that don't involve any physical products. For instance, energy healing, a practice that involves channeling healing energy into a patient's body, is beyond the FDA's jurisdiction. It doesn't involve any drugs or devices, and there's no concrete way to measure its effectiveness using conventional scientific methods. As long as medical claims of healing are not made, the FDA currently has no jurisdiction. So the FDA's reach is limited when it comes to the wide-ranging world of alternative and complementary medicine. It's a gray area, full of complexities and nuances that continue to spark debate among health professionals, regulators, and the public alike. This brings us to the role of the National Center for Complementary and Integrative Health. The National Center for Complementary and Integrative Health, or NCCIH, is many world governments' lead agency for scientific research on complementary medicine. Established in 1998 as part of the National Institutes of Health, the NCCIH has a significant role in the world of alternative medicine. The NIH is part of the U.S. Department of Health and Human Services, and if you remember, the NIH provided most of the information about COVID-19 back in 2021. The mission of the NCCIH is to define the usefulness and safety of complementary and integrative health interventions. But it doesn't stop there. The NCCIH is supposed to take a holistic approach to health, one that doesn't just focus on treating symptoms, but on promoting overall well-being. A significant area of focus for the NCCIH is mind-body medicine. This is a fascinating field that explores the interactions among the brain, mind, body, and behavior. It seeks to understand the powerful ways in which emotional, mental, social, spiritual, and behavioral factors can directly affect health. This can be a game changer in how we approach health and wellness, moving away from a purely physical perspective to an integrated, holistic view. Mind-body medicine encompasses a range of intervention strategies that are thought to promote health. These can include relaxation, hypnosis, visual imagery, meditation, yoga, biofeedback, tai chi, qigong, cognitive behavioral therapies, group support, autogenic training, and spirituality. These practices take a different approach to health, one that focuses on the mind's power to influence the body's health. So, while the FDA may have jurisdiction over certain aspects of alternative medicine, the NCCIH plays its part in researching and validating the techniques that fall under the umbrella of mind-body medicine. Yoga and Tai Chi are pretty clearly not under FDA jurisdiction, but what about bioenergy devices? I have heard some people call their bioenergy device an approved device. This is incorrect. First, a new medical device has to complete an extensive approval process similar to the approval of a drug, and none have done this to my knowledge. Secondly, some will say that it is an OTC device. This also is not correct because FDA has an extensive database of medical devices that may be marketed as over-the-counter, and biohealing devices are not on the list. Such bioenergy devices are not really covered in FDA law. Instead, they are the subject of numerous guidance documents published to assist FDA investigators in the regulation of energy healing. This guidance is the subject of our next section. As we've learned, energy healing, a practice within the domain of mind-body medicine, doesn't fall under the jurisdiction of the FDA. This practice, as described by the National Center for Complementary and Integrative Health, or NCCIH, can directly impact health through various intervention strategies. As mentioned, the regulation of energy healing is determined by guidance publications, rather than enacted law. In 2006, the National Center for Complementary and Alternative Health published backgrounder pages entitled Energy Medicine, an Overview. The documents clearly state that the reports should not be viewed as comprehensive or definitive reviews. Within these documents, energy fields are defined as one of two types: veritable energy fields, which can be measured, and putative energy fields which have yet to be measured. Veritable energies employ mechanical vibrations, such as sound, and electromagnetic frequencies such as visible light, magnetism, monochromatic radiation such as laser beams, and rays from other parts of the electromagnetic spectrum. Putative energy fields, also called biofields, are recognized by the FDA and addressed in 5 different enforcement advisories. Therapies involving putative energy fields are based on the concept that human beings are infused with a subtle form of energy. This vital energy or life force is known under different names in different cultures, such as qi in traditional Chinese medicine or TCM. It's also known as ki in the Japanese Kampo system, doshas in Ayurvedic medicine, and elsewhere as prana, etheric energy, fohat, orgone, odic force, tinana, and homeopathic resonance. Vital energy is believed to flow throughout the material human body, but it has not been unequivocally measured by means of conventional instrumentation. Nonetheless, therapists can work with this subtle energy, see it with their own eyes, and use it to affect changes in the physical body and influence health. Now let's hone in and focus a little on specifically putative energy fields. Numerous scientific studies have been done on putative energy with positive outcomes, from breast cancer to rheumatoid arthritis and much more. There certainly is scientific evidence of the beneficial powers of putative energy, yet so few know about it because it's not covered by most health insurance. You may be able to find a yoga or meditation class at your gym that's part of your insurance program, but that's about the extent of most coverage. And very little exploration will occur because Big Pharma just doesn't want to fund science that could put them out of business. And that is understandable from a profit standpoint. So let's take a look at some of those things that the industrial drug complex does not want you to know about or research. There are at least 20 putative energy methods that all work with the body's energy field, or subtle energies to promote balance, relaxation, and healing. They include Reiki, healing touch; therapeutic touch; pranic healing, quantum touch; Qigong, acupuncture; reflexology, crystal healing, chakra balancing, shamanic healing, sound healing, biofield therapy, magnetic therapy, aura cleansing, color therapy, reconnective healing, Jinshin Jutsu, emotional freedom technique or EFT, and theta healing. For many people, putative energy just came on their radar with the promise of medbeds, which are actually a combination of many of these technologies. In conclusion, while the FDA has broad authority over many aspects of health and medicine, energy healing falls outside of this jurisdiction and under the purview of organizations like the NCCIH. That does not mean that if medical claims of any kind are made, that the FDA won't step in and hassle the distributor. They have done it many times. For this reason, this is a field of medicine that for the first time in my life, I am recommending reading testimonials and reviews and asking questions before purchasing anything. If you are waiting for the free medbeds, nobody knows when they will be here, but hopefully it will be end of 2024 to 2025. When those medbeds get here, I don't know what laws would need to be enacted because if a medical claim is made, they will come down on the provider. Now, I'm not saying that can't be done via an emergency order from the FDA, so it can happen overnight that medbeds will be authorized healing technologies. I think it's all about who is in power regarding the legality and enforcement priority of the future healing medbeds. And if you are thinking that you can just abolish all type of regulation over foods, drugs, and healing devices and drugs, you are wrong. Just go back to the beginning of this video. People are more desperate than ever to find that miracle healing, and I believe it's coming. There are many vulnerable people who will buy anything to get younger or better, but there are many regulatory hurdles to allowing the open use of something that grows your leg back, but only if it promotes the fact that it does. Crazy, huh? Until next time, subscribe, share, and all that stuff because my next video will be about the type of anti-aging and cosmetic changes that can be performed at your medbed appointment. So stay tuned and stay healthy.